An Indiana Senate hearing this week may have placed more hurdles in Union Health's efforts to acquire Terre Haute Regional Hospital. A committee voted for the first time to change the law when it comes to these types of acquisitions. Our Brayton Riley joining us now with the latest on it. Brayton.
That's right, Dana. This change, if it becomes law, could call into question the future of the acquisition. And some local leaders have said they're concerned about the future of Regional Hospital. A bill reversing the Certificate of Public Advantage passed a Senate hearing of the Health and Provider Services Committee this week. If it is ultimately passed into law, this bill could stop the acquisition of Terre Haute Regional Hospital by Union Health. State Senator Ed Charbonneau championed the original bill, but is now trying to end the measure. Charbonneau says he's concerned about monopolies.
January 8th is when I filed this bill. February 5th is when Union Health filed the new application, and on February 11th I received a letter from the Federal Trade Commission talking about against the COPA.
Meanwhile, State Senator Greg Good of Terre Haute told the committee the nearly 600 highly skilled employees of Terre Haute Regional Hospital are hoping Regional does not close.
And here's the thing that bothers me the most. If the COPA process does not proceed, the Terre Haute area will end up with a one-hospital system having an unregulated monopoly.
This has been a little bit of a rocky road so far for Union Health, who withdrew their first attempt at acquisition last year. On Wednesday, Steve Holman, President and Chief Executive Officer of Union Health, told the committee the hospital withdrew the COPA in collaboration with the Indiana Department of Health. According to Holman, they were coming up on the 120-day deadline and felt they needed to get more information.
47% of our inpatient days in 2024 were Medicaid patients. Almost half. It's an area of poor health outcomes that we want to make a transformational change in.
Holman told the committee that Union Health is committed to the acquisition, noting they have paid $3 million in legal fees. The final vote was 7 to reverse and 4 not to reverse the legislation. The bill will now need to go to the Senate for a full vote. If passed, it would take effect July 1st, 2025. However, Union Health has filed a new COPA under the existing law and have 120 days to have the state approve that acquisition. Back to you, Dana.
All right, thanks so much, Brayton.